All right. Good morning, everyone. It's so nice to see everyone. Jonathan, I just want to ask you, is Dr. Fry on the Zoom? I don't see him.
Dr. Fry was not able to make it today.
Okay. All right. Sounds good. Okay, I'm going to make my comments fairly brief because I want to be able to make sure we have a lot of panelists. They have a lot of great information. And so I want to make sure that we can get the media wrapped up in about 15 minutes. So I'm going to ask everyone to kind of cut their comments a little shorter so that we can make sure that everyone does this in a timely fashion. Anyway, I'm really grateful for our panelists today. Many of you know we have a COVID committee at the City of Reno, and we've just been really fortunate to have incredible experts throughout our community on this panel advising us. It's been pretty miraculous with a lot of the data that they've compiled, the information. We have obviously some very, very qualified people, Jeremy Smith, Dr. Jeremy Smith, I got to get used to it, doctor. And we have Dr. John Hess, who's amazing. Dr. Nair, you'll get to meet him regarding the predictive model, which is really, really impressive. Dr. Ron Ariel, I like to call him Dr. Ron. And then we have the wonderful Dr. Eric Nielsen, and then someone who I admire, and she's someone that I just absolutely think we are so fortunate to have in this community, and that's Dr. Laura Knight. She is tremendous. So if you don't know her, you'll get to know her today. We have Councilwoman Naomi Dewar. And she's been heading up our subcommittees and doing a fantastic job. And as you know, she's also a scientist. And so a lot of these experts are either physicians or have amazing backgrounds in epidemiology or, internal medicine. I can't even begin to tell you how grateful I am for this panel and what you guys have given back to the community, all free of service. So you guys are tremendous. And Dr. John Hess, nice to see you this morning. I really appreciate it. So anyway, the last time that we held this press conference, we were talking about, hey, if you can modify your behavior now, then we can avoid some of these tragedies that we're seeing throughout our community. And we're at that point now where we know in the COVID risk meter that we are going to hit purple. And sadly, that was something that when we started the model, that we said we thought we would never reach. And we all talked about that. And we thought if we ever got to that point, how unfortunate it would be for our community. But it's sort of also like, if I knew a tidal wave was coming, would I sound the alarm? Of course I would. And so we have a new predictive model, which is really, really impressive by Aditra and Dr. Ron, who have just done an outstanding job. I don't think there is actually a model like this in the country, a predictive model that I've seen. If you know, let me know. But the work has just been absolutely impressive by both of you. So I want to say thank you. But that model tells us where we are heading. And that model is absolutely disastrous. And so if there's one thing I can stress today is please listen to these panelists. They know exactly what's happening on the ground. They know the data. And it's really imperative as a community, we understand the magnitude of what's happening right now. We are in crisis in our community, absolute crisis. So we all have to understand what it's going to take to do this together. And I hope that some of these messages today resonate with everyone. So with that being said, I'm going to start out with the COVID risk meter. I'm going to hand it over to Councilwoman Dewar and Dr. Jeremy Smith. So Councilwoman Dewar, go ahead, please.
Thank you so much, Mayor, and thanks again to the panel and especially to our media partners for being here today. You hit it on the head when you talked about please listen. I read a recent article and the whole title of it was "No one is listening to us." And I think that the closer we can listen to our experts and learn what they have to share with us about how the pandemic is unfolding, where the challenging points are in terms of providing care, the better we're going to do as a community in terms of responding. The COVID risk meter was in fact designed to be that individual advisory tool to help you know where we were in the pandemic and to be able to let people modify their behavior so that we could in fact avoid, as the mayor said, coming into the purple. We have been set where we're about a half a point away from going into purple or severe in terms of the level of coronavirus in our community and the amount of stress on our systems. So we are right there. We've been teetering there. And what we're concerned about is with the outcomes from the last few weeks of gatherings and shopping and those kind of things that we're going to be seeing this hit us. So again, the COVID risk meter, what we've been doing is refining the tool a bit. We've been adding some usability, redesigning the website, and as you heard, adding a new predictive element so that we can actually anticipate what's coming, whether that's useful for hospitals or our own personal behavior. One of the big issues is not enough people in our system. So we talk about staff beds. It's a key component of our model. We've been doing a deep dive in terms of trying to understand what the beds are, where they are available, and how is that impacting delivery of care in our system. So with that, I think I just want to acknowledge that our most precious resource in this entire thing are our medical professionals, whatever level they're serving at. And to help protect them both most is this COVID risk meter. So with that, I'm going to turn it over to Jeremy. Tell us where we are and what you see coming.
Thank you, Councilman Madure, and thank you, Mayor Sheevy. And thanks for the opportunity here to speak today. I'm going to share my screen. I have a couple quick slides to go through. Are you guys seeing that screen?
Yes.
Okay, good. Thank you. All right. So just quickly want to talk about the current conditions of COVID in our region and the risk meter setting for this week, which remains at very high setting. Our goal in creating the risk meter was really to share with the community an accurate accounting and synthesis of data related to COVID so that residents could make informed decisions about their personal behavior and therefore would help slow the spread of the virus. So our risk meter looks at a spectrum of data ranging from early indicators such as the demand for testing, test scheduling, through to more lagging indicators like hospitalizations and impacts to our hospitals. We created the thresholds in the model based on the data at the time and what we knew and sort of understood about the general knowledge of COVID, several months ago. Well, I'm about to show you a few graphs that emphasize just how much the data trends have changed over the last month and how different the COVID situation really is in our region. So with that, first off, this is a graph showing risk assessments received at the Washington County Health District. It has kind of a sawtooth nature, but I think what you can see is that starting in the end of October, it starts to escalate. That ghosty white line in there is a 14-day average. When we look back across all of this data back to April, basically, the average is somewhere around 270 risk assessments on over 14 days. Well, right now we're at 477 over the last 14 days. So you can really see that the demand for testing has increased dramatically. Even more dramatic increase has been seen in new cases that come every day. So once again, at the end of October, you can see a very steep slope of the graph of new cases coming in. We did our case tracking based on population. So we normalized by a population of 100,000, and we set our model to max out to hit the highest setting at 25. So if you look at the scale on the left, we're up into over 100 or in the 90s. And that, that relates to, our 25 is about 120 new cases a day, and we're having days that hit over 800. So it's just very different over the month of November in terms of cases. And that has a very real impact in terms of impacts to our hospital system. So this graph is now showing hospitalizations due to COVID, and ICU bed use due to COVID is the line with the little orange thing at the bottom there. And I think you can see once again, sort of a few days behind the escalation of cases and demand for test scheduling, you have this increase that just keeps going up in terms of hospitalizations. And so I think from these graphs, you can start to see that the conditions are very different over the course of November, and they do not seem to be abating. This is a graph you can find on our covidriskmeter.org website that talks about how our model puts all of this data together and where we're at. And I think as Councilwoman Dewar mentioned, you can see that we're at 13 right now. We're right up against the edge of this purple zone. And I agree, that's not where we ever wanted to get. We just have a little bit of space left in our ability to handle the escalation of hospitalizations and a little bit of hospital capacity, but it's really being stressed, and I think you're going to hear that from the folks on the panel today. So with that, I'm excited to turn it over actually now to Dr. Ron Ariel and Dr. Aditya Nair to introduce the important new prediction tool. And I believe Councilman Madura may have a follow-up too. So we'll wait in for that. And thank you for your time.
All right, again, going into the predictive model, and I'm excited to actually introduce this to everyone because it really is impressive. So thank you so much. And new to our team is Dr. Nair. He's amazing, and we're happy to have you. He's a new Reno resident, so welcome. I'm going to send it in over to Councilwoman Dewar since you've headed up this subcommittee as well.
Yeah, I think Jeremy gave a great introduction, so I think we should just jump right in.
Great.
Okay, so in late summer, we determined the need to forecast important trends in the pandemic. We wanted to give residents and visitors early warning of increases in cases and to provide hospital and EMS administrators with actionable intelligence so that they could make decisions about facilities, staffing, and supplies. In other words, we wanted to save lives and keep people out of the hospital. In the 1980s, my career at Hughes Aircraft Company, which in Los Angeles, which today is Boeing Space and Defense, exposed me to the math used by guided missiles to track and hit targets. This math is directly applicable to the pandemic forecasting problem. So I wrote a crude prototype program called a Kalman filter to prove the concept, but I needed expert help to build a robust, accurate, and deployable tool that everyone could use. So I asked the University of Nevada, Reno's very first professor of aerospace engineering, Dr. Aditya Nair, to join the effort, and he was all over it. He introduced a lot of new math, and together with elegant computer code written by Jack Hester and Dr. Jeremy Smith, and with critical feedback that we got from Naomi Durr, Heather Kerwin, Dr. Eric Nielsen, and Mayor Sheevy, and other members of the task force, we are now rolling out a powerful tool that provides a week's forecast, and we're working very hard to extend that forecast further. Reno is one of the small handful of places in the United States with such a tool. MIT is the more well-known group. They have a projection tool. But with that, to explain the nuts and bolts, I'm honored to introduce Dr. Aditya Nair.
Thanks a lot, Ron, and thanks a lot for everyone who's been working on this. I'm so honored to be a part of this team, and it's been really fascinating. So I want to acknowledge all of the people here, as well as the people on the COVID warriors on the front lines. So just like Ron mentioned, the predictive tool is designed to provide actionable intelligence through a predictive forecast of indicator variables. So this is just showing you the website, and if you actually go, now we've added this risk prediction tool as well. So what you can see here is what we can expect next week. So next week's risk is predicted to increase, and it is close to severe, and that's the major call for this meeting, that we are heading towards a severe risk assessment. Now, just to give you some more background, the predictive meter runs very much like a weather forecast and gives like a risk score up to a week out based on current trends in data. So the meter was basically fed with data on December 6th, and that was last Sunday, and it gives out a week's prediction to up to next Sunday, and we're gonna update this basically weekly. And like Jeremy beautifully mentioned, all of these different categories remain the same. So you can see here that we are tending towards the severe kind of predictive risk score. Now the back end is pretty much relies on, so you can see this is kind of the back end of all of these indicator variables that Jeremy was mentioning, but now predicted a week out. And this just gives you some indication. The blue is kind of the current data, and the red is just giving you a prediction out to a week. And these are some confidence bounds as to what we expect these indicator variables to be. The backend relies on critical interplay between all of these different indicators, and it pulls out the dependencies in the data. And you can see that all of these indicator variables seem to be escalating now. Really, so it's really critical. So in addition to providing risk, this also gives the hospitals like an idea of the anticipatory needs with respect to beds and staffing, so that we reduce the strain on the healthcare system. finally, I would just like to thank Shawnee for the lovely graphs that you see here as well. Thank you.
I'll just wrap up and I'll just say that clearly, both nationally and locally, our health system's on fire. Prior to now, when a surge was occurring in a different part of the country, we could all come to the aid of that area of the country. Right now, it appears that every part of the country is on fire, including Washoe County. And what's happening is our doctors and nurses are really being affected. We hear that they are burning out in some ways. And I mentioned already, they are our most precious resources. It's not beds, it's staff beds. It's not ventilators, it's who can run the ventilator. It's not just a care center, it's who's out in that garage helping the patients get well. So I think at this point, Mayor, I think you wanted to hand it over to the people on the front line to really talk about what they're facing.
All right, next I'm going to go to Dr. John Hess. He specializes in family medicine at Pinnacle Medicine. I want to send it over to you, Dr. Hess, because if anyone follows you on Facebook, they know how knowledgeable you are. You are a tremendous resource. So if you're not following him, follow him. And I'm going to send it over to you, Dr. Hess. Tell me what you're seeing in your practice.
I appreciate that, Mayor and Councilman Dewar. You know, we're seeing a dramatic rise in not just illness, but the severity of illness. And we sort of predicted this as people moved indoors. We knew that viral dose exposure was going to go up, cooler temperatures. The virus just does better in those environments. And this is very much a person-to-person spread disease. And so while people, I think, worry about surfaces and we want to clean and wash our hands, those are very important things. It's that droplets, it's that aerosolization. And anywhere where someone is being exposed to other people and they're not in a mask, like in an eating or drinking situation, or in large groups where you have multiple people interacting with one another. And by large groups now, I'm talking like 10 people or less, 6 to 10 people. I mean, it's no longer 25, 30 people. And I'll go through some numbers here in just a moment of why that's the case. So we really have to change our focus on what kind of group setting are we seeing this illness transmit in. One of the things, and I could sort of talk about, individual patients, but when you look at the actual numbers of what's occurring in our community, it's horrific. If you look at deaths alone, in the last 7 days, there were 43 deaths directly attributable to COVID. Statistically, based on our population size, we would typically see 18 deaths a week from cardiovascular disease and 16 deaths a week from cancer, which are the two most common killers in our country. Based on those numbers, over the last couple of weeks, we are having more COVID deaths than cancer and heart disease deaths combined. That is a phenomenal number. That is way beyond what you would ever see with a bad flu outbreak. So people need to realize this is not the flu. This is much, much worse, on a scale of 10 times worse, based on these kind of numbers. So, that is an impact. I think we got caught up in case numbers and test positivity and on some level hospitalizations, but ultimately this is all leading to deaths. And they're not all old people. I mean, if you look at some of the people who have died, they're in their 30s and 40s. Yes, it's not teenagers and children typically, although we have had a couple of teenagers, don't get me wrong. But, these are young, productive people in society. Maybe they had an underlying medical condition, but that might have been obesity or hypertension, which are both incredibly common in our society. So you need to realize on many levels, we're all at risk and we need to protect one another as much as possible. The other thing is, if you look at the data, we're sort of seeing a bit of a flattening in hospitalizations, but I fear that some of that is actually due to the deaths. We're clearing out space as people die. So yes, we're maintaining some level of hospital capacity, but it's at a horrible, horrible cost. And as our hospitals are overwhelmed, and I know Dr. Nielsen's going to talk some about capacity and, the number of patients that we call are boarding in the ER, where they're sitting there for 8, 12, 24 hours. And we're not talking a couple, we're talking dozens. They're taking resources away from people who are coming in who are having a heart attack. motor vehicle accidents, surgical emergencies, and all of these things are time dependent. So when you are spreading your resources thinner and the hospitals are spreading their resources thinner, it creates, gaps in time, which unfortunately is lives. So when we talk about deaths from COVID, it's not just COVID, there is a significant downstream effect. And when you put this, when we in retrospect look back at excess deaths, it's going to be unbelievable. So people have got to understand it's all of us, whether you want to believe you're at risk for COVID or not, you are spreading it to other people, or those people are at risk, or you become at risk. So we all have to be on board with this. And then the last sort of thing looking at the numbers is, if you look at the number of active cases in Washoe County right now, there's about 1 out of every 40 individuals in Washoe County is an active case. But we know 2 to 4 times as many people that we know are active are actually currently infected. So that ratio is more like 1 in 10. So that goes back to that group I was telling you about. If you're in a group of 10 or more people, there is a almost certainty that someone in that group is positive. So we have got to get the word out. Our community is just brimming. And last but not least, we haven't hit the Thanksgiving surge yet. If you look at all the holidays that have occurred up to this point, at about 2.5 weeks out, which we're not there yet, is when you start to see the rise in cases, and then subsequently hospitalizations, and then subsequently deaths. So I just want to really emphasize to people, this is impacting a ton in our community, and it's all of our responsibilities to try to protect one another.
Yeah, absolutely chilling. Those numbers are just astounding. I can't even imagine. And I'm so glad you brought up underlying health conditions, because one of the things is that high blood pressure could also be that underlying health condition. And I know so many people that never check their blood pressure. I'd ask everyone on the media here, when's the last time you checked your blood pressure? Because that could be an underlying health condition that you don't even know that you have. Correct. So, I mean, another reason just to be that much more vigilant, right? Because a lot of people don't know. I mean, how many times have you gone in for a physical and they said, oh, by the way, you have diabetes or you have high blood pressure? A lot of people don't know that they have these comorbidities. So that's another huge risk factor. Okay, I'm going to head over to another wonderful, amazing physician. It's Dr. Eric Nielsen. Many of you have read some of his articles in the RGJ. He's outstanding, but he is also on the front lines. He knows this all too well. And when you hear him speak, I'm just in awe a lot of times, with the feedback that you're giving us, Dr. Nielsen. So give us a picture of what it's like to be on the front lines.
Thank you, Mayor Sheeby. To answer your question, it really is getting tough down in the ER right now. Every subsequent shift, it seems like we're seeing more and more sicker COVID patients, not just the cough and sniffles. We're having to hospitalize them at an increasing rate that is starting to threaten the hospital's ability to care for everybody. And I mean, one thing I wish the general public could see is truly how much these patients suffer. I mean, they're struggling to breathe and they're gasping for air. We got to understand that these are our parents and our grandparents. These are our friends and our neighbors, and this is affecting everybody. I mean, right now, Rhode Island has the equivalent of a fully loaded 747 jet as COVID inpatients just at one hospital. And, the frontline caregivers, I mean, we're proud. We're not getting totally burnt out, but we're tired. But we need our community to be there for us because we're trying to be there for them. And so I know it seems like it's a dead horse, but we just got to try to stay home as much as we can, wear a mask like you mean it. And really the biggest thing is look at who you share your indoor air with, because it really is an indoor transmission model right now. And you just got to watch out who you share your indoor air with. And if you have to wear a mask inside, and that's what the CDC is currently recommending. So that's another consideration. But I'll leave it at that and I'll let the other panelists chime in.
Again, absolutely chilling. And I would also sort of express, Dr. Fry is not on the phone with us today, but last night he was talking about, he said it's really hard when you come face to face with a patient. He said the one question they always ask He said they always ask, and I think it just hit home with so many of us. He said, am I going to die? He says that's the number one question that patients ask you. Is that true, Dr. Nielsen?
Yeah, just yesterday I took care of a middle-aged gal whose father was dying upstairs, and I saw her in the tent. And she was sick. She didn't need to be hospitalized, but she had a look in her eye that she thought that she could pass away. And I said, we just don't know. I mean, it's like a hot potato of a virus. It gets passed around, and you don't know if you're going to be the one that's going to have a bad outcome. And I mean, it's like playing roulette. So it's just scary.
Yeah. And one thing I would also say, because people say, oh, the death rate is really low, but Dr. Ron has brought this up so many times. And I think this is also a really critical message, or what they call COVID haulers. And these are people that are going to have residual impacts for their entire lives due to the effects of COVID and how dangerous and disastrous of a virus it is, right? These COVID haulers. So, you don't want this, period. You don't want your friends, family, or loved ones getting infected with this virus, period, because the everlasting effects could be absolutely devastating. Thank you so much, Dr. Nielsen. Okay, I'm going to send it over to our chief medical examiner, Dr. Knight. She is tremendous. We are so lucky to have her in this community. I just absolutely love and adore her. And I can't even imagine what you're experiencing, Dr. Knight. And you've just got to be exhausted, because I'm seeing those numbers and I am just mortified for our community and what's happening. So why don't you give us some insight, what you're seeing?
Thank you, Mayor Sheevy, for that kind introduction. Yes, absolutely. We are exhausted and burnt out because it's not just the COVID-related fatalities. We are having a lot of excess mortality in our region also because people are not seeking medical care. We have more people than ever dying at home, and that's creating an additional workload burden for medical legal death investigation for the coroner and medical examiner system. We are experiencing a peak record number of deaths reported and death scene investigations right now. And I have to tell you that there was no doubt in my mind before I got on this call this morning that our community was headed in a bad direction regarding the pandemic. And after hearing the preceding highly qualified and knowledgeable speakers, I really am truly even more concerned. We can talk about death numbers all you want. And I know everyone's tracking those numbers, but I mean, the fact is we've had more deaths in the last 7 days than we had in the entire month of October. So we've had 43 deaths in the last 7 days, 55 in the last 10 days, however you want to look at it, they're going up, and they're going up at a tremendous rate. At the current rate, I mean, I think we could see as many as 170 or more deaths just in the month of December because of the way this virus is flourishing and the way it is uncontrollably spreading in our community. And unfortunately, as deaths continue to increase, our regional capacity to store the bodies of the deceased in refrigeration really becomes an issue. They have to be they have to be stored in refrigeration prior to burial or cremation, as is required by law and decency. And that capacity is becoming strained. Some of our larger area funeral homes are approaching or are already at their storage capacity. There have been early signs of slowdown in their being able to get deceased individuals to their final disposition, whether that's burial or cremation, or to pick up bodies from our office as soon as they're ready. We have put additional permanent storage capacity in place at the medical examiner's office because of this pandemic. And so I want the community to know that we do have good capacity currently. We can store about 200 bodies, and our census is generally only about 15 to 20% of that, but that can change almost overnight. That can change really quickly as funeral home capacity is overrun, and if deaths increase, as we expect that they may following the holidays. As Dr. Hess says, we have not seen our Thanksgiving surge yet, and I expect it is coming. We're also seeing, a record number of deaths at home that require our attention, as I mentioned, and those are also adding to our body storage caseload. And so it really is becoming potentially an issue that we're not going to be able to store individuals. And I don't want our community to get to the point that New York City and other communities got to earlier in the pandemic, where there is a need for refrigerated trailers or even temporary burial sites to deal with the dead. So I would implore our community to try to take action before we get to that point. My staff are burnt out dealing currently with this heavy record-breaking caseload. They're overworked. As Councilwoman Dewar said, our people are our greatest resource, and they're getting burnt out. We're losing staff. Staff are getting ill, and there are just not enough people. And we're adding emergency staffing as well. So the situation is not good right now. And now is really the time for people to take action, to choose to stay home, to wear a mask, and please, please, to avoid holiday gatherings before this public health nightmare becomes even worse. Thank you for the opportunity to speak today, Mayor.
Oh, great. Yeah, fantastic. Thank you for those messages, because it's so critical right now. And I know, because everyone thinks I'm a Grinch, but bottom line is we are going into another holiday. And again, I think Councilwoman Dewar stressed this. We have not seen the effects of Thanksgiving yet. I think Dr. Hess, you said it would be probably another week until we saw what the results were from holiday gatherings?
Yeah, probably the earliest would be the end of this week, maybe the beginning of next week is when we would expect cases start to rise based on past. And that's sort of what Heather Kerwin had indicated as well on the call last night. So it may occur a little bit sooner. It may be slightly delayed. We'll just have to see. But I think people tried as best as they could over the Thanksgiving holiday. So, I'm always kind of an optimist, and I hope maybe it won't be quite as bad as we fear. But I also know, it's such a strong thing for people to want to gather together over these holidays. And if you look at travel, travel was still, much, much higher than it should have been. And so I do worry we are going to see a significant rise in the end of this week or beginning of next week.
Right. And another thing we talked about last night, which I thought was really interesting, how many people always say, oh, I'm being really, really careful. I'm being really careful. And some of those actions, they don't really realize that's not being really careful. There was a woman I know that contracted the virus, and she said, I've been staying at home. I've been wearing my mask, being really careful. And we asked her, well, what did you do for Thanksgiving? And she said, oh, I had some friends over in my garage, and I lifted up the garage, and just thinking that, the garage being open and having some of that open air was okay. And so I think that people have to understand that they might think that they are taking the precautions that they need to, but some of those decisions and precautions are not actually the safest ones. So again, I can't stress enough. And I think Dr. Nielsen, you brought up, the air circulation. And what I'd like to find is, and there are experts out there that do this, because I've listened to many podcasts on air circulation and how to keep people safe when, it comes to sort of air circulation and the things that you can do to minimize those risks through air circulation. So it's probably the next agenda in our COVID committee. So just to talk a little bit about that, but thank you so much. I really appreciate all of your time and being here today. It really means a lot, because this message is so critical for our community. People are just not getting it, and people are dying. I now know 5 people personally, good friends, that have passed away from this virus. And I can't imagine that it's not hitting every single person in this community in some shape or form. And the other thing I just want to stress, speaking to a friend of mine that his mother just passed away, I can't even imagine saying goodbye via FaceTime. I mean, that is just absolutely horrendous. And that should just never be. So, I mean, and I was just reading an article that approximately 10 people are grieving when they lose someone. And so if you do the math, the amount of grief throughout the entire country is something we can't even wrap our heads around. So all I can just beg and plead for people to please do your part. And again, Dr. Nielsen said, hey, we're here for you. We need you to be here for us. And that is absolutely 100% true. So thank you, Dr. Nielsen. I'm going to send it back over to you, John Humpert.
Great, good stuff. We do have a number of people here with questions and everything else, so we'll do our best to try to get through it quickly. We're going to start with Bob from This Is Reno. Go ahead.
Thank you so much. In regards to the body storage issue, I believe last week, Dr. Knight, you said that this was going to be a concern coming pretty quickly. Have you seen a change in the last week other than, what you've mentioned already?
Yes, in the last week, we have seen more slowdown in the capacity of funeral homes to pick up bodies from our office. We are having more funeral homes telling us, I'm sorry, we're at capacity. Can you store them a few days longer while we try to manage our capacity, and then we can take that person in. So I can see very quickly where we're going to get to kind of a waiting list situation with some of the funeral homes. And last week when I spoke, it was really only about a couple of the very largest locations. And now I'm seeing that trickling down to some of the smaller locations as well.
Thank you.
All right, good stuff. We'll go to Sam next.
Oh, I'm sorry. I have a question about the predictive models. There's 6 indicators on Dr. Nair's chart. Can you walk us through what those indicators are?
Well,
Sorry.
these are the,
Yes, absolutely.
Go ahead.
Sorry, Ron. So these indicators are the same ones that Jeremy was, mentioning. So you have these risk assessment scores, which is the number of risk assessment forms that is being filled in for, when you go and take a test. Then you have the test positivity rate. So this is kind of an indicator that we've seen is more sensitive. Then you have the daily new cases. That is the third indicator. And that's normalized based on the population size. And then these two indicators are, so the 4A, 4B are the kind of hospitalization due to COVID. And the final is the total kind of, bed use because of hospitalization as well as the ICU usage. So those are the kind of total of 5 indicators. I mean, of course, there are subcategories, but yeah, we use the same indicators that Jeremy and the team basically designed for their risk meter evaluation.
Yeah, I'll just jump in quickly. The indicators 4A and 4B. 4A is about total hospitalization due to COVID, and 4B is specifically looking at ICU bed use because of COVID. And then indicator 5A is total hospital staff bed utilization or capacity that remains. And 5B is specifically looking at the staffed ICU beds.
We wanted to make those to break those out because that's what allows the predictive tool to be used by hospitals or EMS or even later by the health authorities distributing vaccines to check for the efficacy of the vaccine program. If we had just provided a tool that's just an overall tool of showing where the meter's going, that would not have been useful enough.
Is the reason the slope looks similar on all of them have to do with how you set the y-axis? And is the reason all of them look pretty linear have to do with how you're modeling it?
Yes, absolutely. So we actually played around with a lot of like cross-validation and models. What we saw as the best kind of model that we could get is through like a linear modeling strategy. We also incorporated like second order polynomial elements in our models for regression. But yeah, I mean, not diving too deep down the technical wormhole, but yeah, you're absolutely right. It's basically showing mostly local linear trends in the data and where we're heading towards. Thank you.
All right, very good stuff. I don't see Stanton on here. Do we have another colo person? Okay, doesn't appear so. We'll go now to Miles with 4.
Oh, gotta unmute myself. Hi. Kind of any of the doctors or any of the city officials that kind of want to comment on this. With hospitalizations on the rise, ICU beds being harder to access. You mentioned 2 weeks ago about the possibility of having to use other resources, including the Reno Event Center, as a possible overflow for hospitalizations. Obviously, there's concern when it comes to also deceased as well. Any talks about what the next steps would be? If we do enter severe by next week, what would the next step be if we reach all hospital capacities within the region?
Yeah, I'm happy to speak a little bit about that. Certainly, we are prepared. We've been prepared for a while. So like I said, we can stand something up within a matter of just a few days. Unfortunately, we don't want to get to that point, right? I also think that we have to be really careful when we talk about beds, right? We might have enough beds. What we don't have is enough staffing. So we really want to stress, that point, because a lot of people keep saying, oh, I can see the percentages through the hospital association, and I can tell you're not at capacity. So, that's different from staffing and then patient use. And so we have to be really careful about that so that people understand we are at capacity. I'm on the phone every day with almost all the hospitals, just making sure that we're coordinated in our efforts, that if we have to do something really quickly, we're ready to go. We've been ready for a long time. Obviously, we don't want to get to that point. We're fortunate in the fact that we have a community that rallies around each other, but all I could stress and say is we need you to rally now. We're not in that position where it's like, oh, 2 weeks. I mean, it's here now, and we know we're going into the holidays. So if there's any one thing you take away from this, it's not that we have time to prepare or plan anymore. Everyone's got to do it now. This is the time to take it seriously. I cannot stress it enough. I don't know what more I can say, what more I can do, other than please, as Reno residents, I am begging you to do whatever you possibly can to help our healthcare system. And again, people forget, if you should have a heart attack or be in a car accident, your care could be compromised. So even if you're well and you don't have the virus, you need to think about the after effects of what that could cause in your life. So everyone has got to be really diligent about their behavior right now, and think about others. That's the one thing I would say. We have got to think about each other right now. Let's take care of each other, and certainly our healthcare workers, because they really are our heroes. And people are not, they're not seeing that. And I think there's a human element that's really missing here, but obviously there's HIPAA compliance and things of that nature that we have to adhere to. So a lot of times you probably don't get to see that firsthand situation of something so incredibly tragic. But it is, I can't begin to tell you the stories that I hear from nurses that call me, and our physicians, and everyone on this panel. People are exhausted. They are absolutely getting exhausted. I cannot imagine what it's going to be like at Christmas time. And all I would ask is, please, whatever you do, think about those Christmas plans and modify them severely, because we all need your help. And I just can't even stress it enough. I don't even know what more I can possibly say other than I am begging you.
I'll just add something too, to build on what the mayor said in terms of the staffing. I mean, I know nurses too. Nurses are wired to care about people. That's how they think. That's how they feel. That's what they do. They've put their lives on the line to take care of people all day long, much like our physicians. But what's happening is, as much as they care, they're having to, in some ways, shut down their feeling and shut down their emotions and just try to get through the day. And in fact, that is in part why we've moving towards offering our mental health care through our telehealth, our system, Talkspace. But I mean, we need to be able to help our providers. And I'll just say this too, is I think one of the purposes of this call is really trying to ask the question and answer it, which is, what will change hearts and minds? Our greatest resource is the people of our community, as the mayor said, and it's really a call to action for them. Our greatest hope is our residents. Their behavior will affect all of our lives. It will affect our institutions. It will affect our capacity. What we don't want is those people to shut down, call in sick themselves, and just not come to work. Because what I've heard from some of the doctors is they're going from staffing, a typical staffing would be 1 nurse to 5 patients. They're talking 1 nurse to 10 patients. And I heard yesterday 1 nurse to 20 patients. I mean, if you're one of those patients, that is not the level of care that you would want if you or your loved one was in the hospital. So I think that's a sobering number. I've had people in the hospital, I've been in the hospital myself, and there's lots of stuff you need. And so I think those are some numbers we need to take away. But a big takeaway here too is our hope is relying on our citizens doing the right thing.
Good stuff. Thank you, Councilmember. We'll go to Mike Stephenson.
Hey, we heard a little bit, and this is probably for some of the medical professionals, but we heard yesterday from leaders on the task force how this is disproportionately affecting certain ethnic groups. I wonder if you could just take us inside and kind of let the community know that that is in fact the truth.
I'm going to send it over to Dr. Nielsen.
Yeah, the CDC finally published some really robust data on the certain subsets of population that are disproportionately affected. And the numbers are very concerning and there mostly revolves around ethnic minorities. African Americans, Hispanics, Pacific Islanders are disproportionately affected. The hospitalization rate for those populations is almost 2 to 3 times, maybe possibly even more than the other part of the population. And to be honest, down in the emergency department, I personally feel the Hispanic community in Reno is just getting crushed by this. I mean, probably on a given day, I'll admit 2 or 3 Hispanic patients that are sick enough to get admitted. And you know, there's also a lot of the nursing home folks are coming in, and that's a mix of all different ethnicities. But to be honest, the one population, especially in Reno, say it's like a random 50-year-old that's relatively healthy, or you would think, but they might have a little bit of high blood pressure, maybe a little bit overweight. The Hispanic population is really getting hit by this virus worse than the others.
Mm-hmm.
All right, really appreciate that. We'll go to Brian next with 2.
Thanks, John. So taking a look at the predictive model, it's showing that tomorrow we're going to hit this severe range. Is that something that we might be pushing towards tomorrow, that we are going to increase that range? And then I did have a follow-up question too, kind of, and I don't mean to be crass at all. I'm trying to push this meter as much as we can over at 2 as well. But what exactly is this meter for? We're not seeing any public awareness campaigns, and really the only place that you hear about it is when media organizations pick it up. Is there going to be some type of push? And really the only agency that I can think of that really uses this meter, and I guess that's even questionable, is the Washoe County School District.
Well, you know, I can, in answer to the question about what happens tomorrow, yes, the meter is pointing more severe, and that's a signal. You know, that's a signal to you and to anybody who's looking at the meter to take action. And what that means is wear the mask, stay home, don't invite anybody over to your house who doesn't already live with you. If you have to go shopping, do it on the internet and pick up your groceries at the curb. Don't go to gatherings. If you have to be with other people, you know, if it's absolutely required, meet with somebody well away from you outside for less than 2 hours, and even avoid even that. If you can do it by phone, if you can do it by email, if you can do it by Zoom, do that. Just that's the signal. Now, as far as how wide and well the meter is used, I don't have statistics to show exactly how many people are looking at it. You participate in this call. Obviously, you know that on media calls, it's being highlighted. We are pushing to tell everybody that we know about it. You can for the questions about how, that particular campaign, I would defer to Mayor Sheevy because she knows a lot more about that aspect than I do. But the meter is there for everybody. It's there for the public. It's there for the hospital administrators, the EMS administrators. And I can tell you the hospital administrators know about this meter. Okay, Tony Slonim knows about it, and the administrators at St. Mary's know about it. And it is a tool for them to use. And it actually dovetails nicely with the kind of tools they already use right now.
Right.
I'll just add to that. You're correct that a tool is only as good as it is adopted and understood. We are trying to get people to understand it with your help. We do have a major media campaign that's been gearing up, and I'm sure it's going to be relying on the meter. Additionally, we're starting to count hits. We are updating the website so that we can do that, so that we know actually how many people are checking that meter. We don't have that information right at hand, but you're absolutely right. And you play a key role in getting the message out. And so a lot of it is in your hands. I will say that something I've talked to our communication staff is about starting next week, potentially, these mini town halls, so that we can actually speak directly to people and they can have access to the doctors and they can ask questions themselves about the meter. One of the things is that the meter doesn't change every day, and we designed it that way on purpose. So it's not like you're checking, is it 95 today and 93 tomorrow? And is it going to be 100? What we're doing is talking in broad strokes. Is it in the 90s? Is it in the 80s? Is it in the 70s? Or is it over 100? And right now, to use a temperature gauge, we are in the 90s. We're headed for the hundreds. And so that is one of the challenges, is how to get it out there, and it's only as good as people find it. And that's why we keep refining it and amending, adding new tools like this predictive capability.
Mm-hmm. And I would just ask the news stations, and you guys have been tremendous in helping us. And I met with your GMs last week. And again, this is really a community effort, all of us working together. And I would just ask, much like when you guys see the burn code leading into your newscast or out of your newscast, or the pollen count into your newscast, out of your newscast, I would just encourage you to use this same tool to be able to convey that message. Because I think, it is now more than ever, I am hearing people say, wow, I probably should start modifying my behavior. People that I know that, thought, this was not real. So I do think people are starting to hear it over and over and over again. But, we also have talked about this COVID fatigue that people are, constantly talking about. And I think with graphs and things like that, people are tired of seeing them and saying, what does that really mean? I think now more than ever, it really has to come down to, the human compassion element of how this is going to devastate communities across our country and across the world, quite frankly. And I would say this too. I really believe that we are going to have a very tough 6 months. Now, there is hope. Obviously, the vaccine today, you saw in the UK, a 90-year-old woman was the first woman to receive it. And she was just tremendous, I thought, and did a great job of saying how excited she was, right? There is hope, and it is happening. But we are not going to see a lot of hope in the next several weeks. And I think everyone has to be really, really aware of that and protect each other in our community. We need you in our community. We're all in this together. It doesn't matter who you are, where you come from. We are all in this together. Now, of course, hope is going to be really important, and we're going to get there, but not right now. People still have to understand the massive severity of this virus.
Thank you for that. I just had one little clarification though. So if the predictive model is correct and we do go into the severe range tomorrow, will the meter not be updated until next week, since like Congresswoman or Councilwoman Dewar said, it's updated weekly, not daily?
Like Jeremy's ready to answer that.
Yeah, correct. I'd like to just give you the kind of the nuts and bolts of how we do it. We do calculate every day. So you can go to the covidriskmeter.org website and every day see how the scores line up. But we didn't, sometimes when it's at the edge, our guidelines for risk were somewhat, too different. And we want to make sure, to Councilwoman Dewar's point, that we're kind of giving you the general sense. So we have moved towards the weekly setting. So every Monday, I get the data, which has been kind of collected but not shared over the weekend. That's kind of a limitation of the data delivery. And so I have everything. I can put that score together on a Monday, and I look back to the previous week to set the next week's setting for the gauge. And at that same time, I pass the data to Aditya to run the prediction. So by Tuesday morning, there will be an updated weekly setting as well as an updated next week prediction. So if you want to hone in on helping us with, getting the word out, Monday, Tuesday, that would be the time to check in on the website and add that to your story or to your media to indicate where we're at and where we think we're heading.
Thank you.
Awesome. Fantastic. We've got two left. We'll go Saban.
Hi. So you think though, even though it won't be updated, it'll hit, just a quick, it'll hit purple tomorrow is what, based on the stats, even though it won't be updated till next week? Is that, I see Dr. Nair saying yes.
Correct. And that's what we think. And so we will
Okay,
see,
but you won't update that till next week. And what's the, I know we've seen the red now for very long that says very high and it has that little red type under it. What's the purple type say? What will that say? Like,
let me
don't,
pull that up exactly so I don't tell you the wrong thing.
Yeah, and while he's pulling it up, I just want to be clear that we're not going to, the prediction is an anticipation, but Jeremy's not going to post something unless it's based on real data. So he's reflecting what is actual, not, you know, so we have both measures. So you just have to be clear on which you are talking about.
but everyone thinks we're ready to hit purple. There's some chance we won't, or we're hitting purple.
So I'll just explain this. If we hit purple 3 times this week, it will switch to purple.
Okay.
So we look at the weekly average, what's happening the previous week, and that causes a change in the weekly score.
Okay, but purple is, yeah, I'm just like, you think purple is likely to be hit at least some of the days.
There's a high probability of it, yes.
I would just say this week, it's likely.
Yeah.
This week, it's likely to hit purple. And purple means exactly what
I have here
to
what
Dr. Hess or Dr. Nielsen? Purple means what?
Very severe.
Very severe, like don't leave your house. What's it?
What?
Tell it. It means.
Well, Jeremy actually has what we've written up. So if you could share that, Jeremy.
Yeah, and it would look like this. And at this stage, our community is in crisis mode. Our case numbers are critically high, and our hospitals are at or near capacity. Shelter in place. Don't leave your house unless you absolutely have to. Strict mask compliance outside the home.
So we're kind of at that point. I mean, with hospitals, it's crisis mode now, right? I mean, it's not purple, but to all the doctors and to everyone on here, we're at crisis mode.
I would say absolutely. Yes. We need to, I know that we don't have a shelter in place order and there's a lot of political aspects associated with that. But from a medical standpoint, we need people to take that approach.
Would every doctor on this call say shelter in place today?
Say that again. I'm sorry.
Would every doctor on this call say shelter in place today, if you can? Just as a doctor, not as somebody who's deciding the economy, as a doctor, should you shelter in place today?
I would say stay at home and go out only if it's necessary, and don't bring people over to the house. Don't have friends over. And if you absolutely have to meet with somebody, do it by video, do it by telephone.
So shelter in place.
Do it the safe way. Be safe, and also use your common sense. Okay, protect other people.
And when we say shelter, I think that's exactly right. I mean, when you talk about shelter in place, it doesn't mean that you can't do certain activities, but they have to be justified. Your work should be making accommodations for people to work from home, if at all possible. They need to be making accommodations to make sure that people are spread out. But work is an essential function for most people. So, I think that it gets a little convoluted when you start talking about shelter in place. But the reality is, the more you can be at home with just your own subset and not intermingle with other people, I think is exactly what we should be doing. That is how we're going to save lives and get through these next few months. The vaccine is going to ultimately get us back to some degree of normalcy, but that unfortunately is going to take several months, many months, most likely, to get there. So in that interim, we've got to take this approach of really, really minimize our interactions with other human beings in a person-to-person setting. And when you do have those interactions, really sort of do a risk assessment, right? Like, do I really need to go meet with Susie, or can I do it outdoors on a walk where we're both in masks, or if we need to even do it in person, if you can do it, electronically. So I know that people want that human interaction, and that's really important from a mental health standpoint. So we do need to recognize, and that some people really just are going to need that human to human interaction. but try to do it in as safely as possible and with the least number of people, you know, and try to, yeah, that's the best I can explain it.
And that means your family too. The sister who lives across the street shouldn't be coming over to see you.
Right.
Okay.
The purple says, the purple says shelter in place, the writing. So it just makes me think, okay, we're at that shelter in place. The purple type says shelter in place. And we're going to hit that this week.
And again,
I expect to hit it this week. And this hasn't taken place yet. We will know next Monday or Tuesday where we stand.
Right.
It's an average of several weeks. There's no like magic day that it was red yesterday and it's purple today and we have to like change our behavior entirely. We have been, all of us on this call, advocating for people to be careful, wear their masks, keep their social distance. That's been the message from phase 1 or even the yellow all the way up to the purple. Nothing changes really.
And then with the data, is there something beyond purple? Like you've never expected to get this level? Do you have to readjust it? Because could the numbers be so bad where then we go into a different color code? Like, do we go to black or do we go to?
You've thought about black, but it's really purple plus. I mean,
purple plus, like
the hospitals only have so much capacity. There are only so many providers and caretakers available.
So what happens after purple? What happens after purple?
I will leave that to the doctors to speculate.
All right,
Good question, Siobhan. Just so you know, now I know this isn't popular, but I would recommend if you can stay home, please do that. I have people still asking me, hey, can we meet for coffee? I mean, we can call each other on the phone. Come on, let's think about this and be smart about it, right? I still have people sending me, hey, can you do a ribbon cutting? Now is not really the time to be gathering for those sort of extracurricular activities. You might think it's essential. That's not essential to me. What's essential is, you know, going to and from work, going over to friend's house is not essential. So I'm saying stay home, you know, and that can be construed as shelter in place. But I would say if it's essential functions, then we want you to do that. Also, medical care is really important. You heard that from Dr. Knight. And I know a lot of people get apprehensive about, you know, getting medical treatment, but I did go to the cardiologist last week. Of course, I, you know, was uncomfortable doing it, but guess what? They also had telehealth. So call your doctor, get care, call your doctor and ask them, are you doing telehealth, right? Many of them are. If not, I got to tell you, they were very smart about it. They only had a couple people in the waiting room. They had a very low level staff so that they did not have a lot of people in the office. Everyone absolutely was masked up. When they took your temperature, they also made you wash your hands. And so I would say for healthcare, they are doing a great job. Even our dentists are doing a great job when it comes to getting your teeth cleaned, or if, you know, I've had issues with that a couple months ago too. So I'm just sort of doing essential functions. I'm working from home. I am seeing my doctor if I need to. I am doing telehealth. I am not meeting people for coffee. I am not doing ribbon cuttings. You know, I know it's hard for people, but when we talk about, hey, you know, it's Friday night, maybe you don't go and meet your friends. Let's all do this together. Let's do it for one another. And I think, honestly, this isn't years. This is literally, you know, weeks, right? Now we're sort of in this weeks part where we're going to start to see some light at the end of the tunnel. So everyone's got to have hope. And right now, help us get over the finish line, but also be smart about those decisions of what you are doing out in public. Again, meeting for coffee, I don't think is smart. If you are a business person and that's the way you conduct business, why don't you start making phone calls or doing Zoom meetings for the next, you know, 3 to 4 weeks? And by doing that, you might be really helping someone in the hospital and save lives. By just doing that, you might be saving lives. So that's all. If I could stress one thing, it's being smart about your behavior. Yes, go to the grocery store. Yes, absolutely get your health care. I think those things are critical and essential, because you are seeing people that hold off and they do become ill, and that becomes, you know, that much more of a problem. So, and you heard Dr. Knight, you know, I think she said it really, really well. So be smart about the daily activities that you engage in.
Great. Thanks so much, Mayor. Real quick question from Lucia, and that'll be our final one. Go ahead.
Hey, John,
Yeah.
Bob Conrad, I've had my hand up for a while. I have one follow-up question after Lucia.
We got to be super quick. This will be the final question.
Okay,
Go ahead, Bob.
I just have a question. 2 meetings ago, Shivi, you said you'd be interested in implementing a fine for folks not wearing masks. I guess I'm just asking, what are you trying to do differently? It seems like asking folks to stay at home. The people who are going to stay home are going to stay at home. The folks who are not are not. So I'm just asking, what are you doing differently? And then why are we not tightening restrictions if we are in such this severe crisis mode?
Well, right now, as you know, we're under the governor's directive. And so we're in communication. And so we sort of look into his next directive, what that looks like. And I would say we are absolutely, and I think it's interesting because some people, I'm not so sure they got this. There is a mask mandate in place. There is a mask mandate in place. Okay. I think everyone forgets that. And so I would like to take further action at the city of Reno. You know, obviously I don't have enough officers to be able to touch everyone in the city. So what I'd like to remind everyone is there absolutely is a mask mandate in place. And again, I'd like to bring it back to our council to see, you know, what things that we can put in place, whether it's fines or corrective actions of things of that nature of not wearing your mask. Now, I will say this, everywhere that I have seen people out, they are wearing masks, which is good. But I still think that, I think too, if you are outside, this is the time to even still wear it. I just think right now you should take every single precaution. And even for, I have friends that are outside the home healthcare workers. I can't begin to tell you how the people that they're interacting with, because they have all these patients at home that they're interacting with, are talking about, you know, literally getting in, getting out, being really quick in their approach, but also wearing masks outside. I know that a lot of people think because you're outside, it's safe. I would say right now, wear a mask outside because you don't know when you can come in contact with someone. Matter of fact, I went and got my mail the other day and my postman pulled up, right? So you just don't know when you have these interactions, even outside. So I would just stress, you should be wearing your mask at all times. You even heard at Thanksgiving dinner that they were saying, wear your mask inside, right? And again, I think, you know, what a challenge that is, because if you're eating, you're taking off your mask, right? So I would say modify your behavior, maybe, you know, forgo this next holiday dinner with someone so you can have holiday dinner with someone for years to come. Think about it like that. But again, we are under a mask mandate. You know how I feel about masks. I think, you know, it's the only thing that we have as protection. Someone just said it the other day, look at it like the vaccine. The vaccine is 100%. Do we know if masks are 100%? No, they're not, right? But there's certainly a way to help. So why wouldn't you do everything in your power to wear a mask? And again, I'm a big believer in it. And we are under a mask mandate. Hello, everyone, mask mandate in the city of Reno, actually all across Nevada. So I don't know why that hasn't resonated with people, but it certainly is in place.
If you are interested in implementing a fine, why haven't you proposed that yet?
Well, we've been going to our city attorneys, and some of it is that we have to get the approval of the body. And so that's something that we have been looking at. I proposed it a long time ago. And so, you know, we really felt like, hey, we wanted people to do this, you know, collectively, and to do it because they want to do it. We don't want to have to be out there fining people for not wearing masks. We want people to understand this is about taking care of each other and doing what's right in your community, right? We really thought that that might have been the best approach instead of the hard approach, but I'm all about the hard approach. I really am. I'm at the point where I think this just is not fair for our doctors and our nurses. And it's not fair for those that have lost loved ones. You know, I just have to tell you, I mean, it really is something that you just shake your head when you hear people that tell you it's a hoax. I mean, go right now, go on Twitter and make a mask post, and you will see it immediately how it becomes political and divisive. That is not what we need. Right now, we need community coming together. This is not about party, it's about people. I get very worked up when I talk about masks. I had just for example, and I think I brought this up last time, I had a kidney transplant 20 years ago. They asked me at Stanford to wear a mask. And I said, why? And they said, because it will protect you. Your immune system is low. So we need you to be protected because other people could have something that, because you're on immunosuppressants, could really affect the survivability of this kidney transplant. Well, with that being said, they clearly knew something 20 years ago. This isn't just something we just started yesterday. So, and also, hey, maybe Dr. Nielsen, Dr. Hess, you guys wear a mask, I'm sure in the OR, and maybe tell us the reason.
So yes, masks definitely protect both the wearer and the person that you're exposing. So, I know that we talked a lot about masks early on about, protecting others, and it clearly does that by lowering the droplets that come out of your breath. But there's lots of evidence now that masks also help the person who is wearing them. And if you have both people wearing them, the incidence of spread is very low. And there's good evidence that if you contract the virus and you're wearing a mask, the likelihood of severe disease goes down. So, there's been some good studies like on cruise ships, for instance, where they had everybody masked up. This is when they wouldn't let them come back into the country. And the incidence of severe illness was way, way lower than in the cruise ships early on where they weren't wearing masks. So it goes back to that viral dose exposure. And so the masks not only protect the persons around you, they do help protect you too. It's not 100% as Mayor Sheevy was saying. You can still get infected. You theoretically can still get sick. But how sick you might get could also be determined by that mask.
All right. Thanks, Dr. Hess.
Sorry, John, just
Yeah.
to clarify that too, Dr. Hess, because I think it's important that people need to know that's also based on the amount of exposure from the viral load. Am I correct?
Absolutely. Absolutely. One of the things I've kind of tried to explain to some of my patients is, we do lead shielding when people get x-rays. And if you think of the virus as kind of like radiation, and the amount of virus you get is dependent on that mask as your lead shield. So, sometimes we have to change how we view things, and it does provide protection. Absolutely.
Yeah, and I'd like to just take a stab at Lucia's question as well. In addition to everything Mayor Sheevy said and our doctors, what we've done in the interim is to better enforce the existing statewide mandate. So it's important that we are doing everything we can to actually fulfill the existing rules in place. And so you've seen our own staff and the staffs of the other jurisdictions really step it up, take it super seriously. They have gone right up to the point of closing businesses down. So I think that's an important next step, even before Mayor Sheevy talks about additional requirements or mandates. Let's enforce the mandates we have in place. And that is exactly what we're doing.
Good stuff. We are super over time, everybody. If there are follow-up questions, by all means, email them to me and we'll do our best to get to them. So thanks, everybody. And again, we'll have this, as always, standing here in about 2 weeks or so. Thanks, everyone.
All right. Thank you so much, everyone. Thanks, you guys. Be safe, be well.